My name is David Fessman, President and CEO of medmore. I'm here today to talk about some of our hospital beds, home care beds, and resident beds. We have a few different main kinds of hospital beds. You have semi-electric, full electric, high-low, and adjustable beds.
When a patient needs a hospital bed at home, sometimes that is a difficult case because they're so used to having that hospital equipment that is more industrial graded.
So it's really key to take a consultative approach in understanding why they're looking for a bed. You might ask the customer, is this person going to be in the bed all the time? Are they able to move around? Are you using a lift to transfer them? Are they in a wheelchair? Are you going to be transferring as well? It's important to really understand how the bed is going to be used, how they could transfer in and out safely, and how much time they're going to be in it. So beds, there's a lot of different solutions out there, but again, it comes down to what the customer needs.
An entry-level hospital bed is a semi-electric hospital bed. A semi-electric hospital bed is something that Medicare or private insurance like Anthem will pay for.
The head of the bed can be done by the patient with a corded control. The height of the bed, getting the patient lower to the ground or higher in the air, is more a convenience for the caregiver.
So it has a controller, it's fully electric, but if you want to control the whole height of the bed, it's a crank, and you crank it up and down. And some of the disadvantages of that is that some people need to change the height of their bed up and down often. So full electric hospital beds are basically everything's electric, even controlling the height of the bed up and down. Medicare and other insurances don't cover full electric hospital beds. What they usually do is some providers will give you the option to charge a deluxe upgrade on your insurance. Sometimes people just end up running out of pocket for a full electric hospital bed, or they just pay for it in full so they can get the features they want. The next type of bed is a high-low hospital bed. The main differentiator between a high-low bed and a full electric bed is that it is fully electric, but it can go all the way down to the ground. The features of that are great for assisted livings, great for people that might be at a fall risk, because once the patient is in the bed, they can be lowered so low to the ground. And then you have some of your more deluxe beds that might have low air loss mattresses, AP&P mattresses. There's a whole wide range of different mattresses and beds and different features. And then what's the best mattress for my loved one? So we have, foam mattresses, memory foam mattresses, extra long, extra wide mattresses. What's their height and weight? What medical condition do they have going on? Do they have breakdown? Do I need a low air loss mattress because I have breakdown going on? And a lot of that's just, you need to talk with someone that's an expert and that can be a resource for you. If you don't qualify for a bed through insurance, here's your options. If you happen to be local to Cincinnati and Dayton, you can rent from one of our brick and mortar locations. We have all of our prices listed online, or you can call over the phone. If you happen to be outside of Cincinnati and Dayton, you can look for a rental company in your area. Simple as Googling rental hospital beds in your area. And then the next option, which has been very popular, is you can pay cash for the bed. Because a lot of times this bed is going to be in their home for years, and you're going to need this bed for years to come. So you want exactly what's going to be the best solution for that patient. It's about finding the right equipment for them, and that's where a lot of people pay out of pocket for really nice beds like the Carroll CS7 bed by Invacare, Hillrom's beds, many of the different drive beds and Medline beds we have. If your patient or loved one doesn't like the idea of a hospital bed, that's where our adjustable beds come in. We have multiple different brands from Sleep Logic, White Glove, Brio, Flexibed, and they look just like a regular bed, but they have all the functions of a hospital bed. And you can also get it where you could have a dual king. So let's say not everyone wants to sleep, they have a loved one. Maybe they want their dog in the bed. So you can get two twin beds side by side that are adjustable for them. So you can raise the head, move the feet and legs separate. You can get zero gravity position. There's plenty of hospital beds that have great, nice wood headboards that blend right in with your own home decor, where adjustable bed's more for someone that doesn't need the positioning and some of the skin protection qualities that a hospital bed might be able to offer. One of the most popular beds that we have is the Invacare CS7. It's a great resident bed for in your home because it has all the features of the most expensive resident care and hospital beds, but it doesn't have the price point. It's a high-low bed. It's got a great support system. It comes with great mattress options standard. It's great for when you're taking care of your loved one in your home, Recently, we're proud to announce that we just formed a partnership. We're one of the exclusive vendors with Hillrom hospital beds and LECO patient lifts in the Cincinnati, Ohio area nationwide. You can have the same bed that you had in the hospital at home. And when you're bedbound and when you have specific accessibility and mobility needs, you need the best.
And my job is to help understand what the situation is and providing a thorough solution for them and getting them onto the right bed.